Hello, I'm Florence Nijena, and today's topic we are going to talk about healthcare career option. As an outline, I'm going to talk about overview about healthcare career option, where we found some types of career option like licensed practical nurses, registered nurses, and practitioner level of nursing. Also, there is a description of non-clinical healthcare jobs, and lastly, I'm going to explain allied healthcare professionals and show the references. Starting from non-clinical jobs, those are the jobs which are in healthcare organization, but those people who work on those positions do not meet with the patient directly. Some of those non-clinical jobs are medical assistant, which are those people who assist where those people you can find in the doctor's office before you meet with the doctor. Those people can give you an appointment with a doctor. Also, they can like make the simple tests like blood tests, blood pressure, or some lab tests which are also simple. The other non-clinical job is healthcare information manager. Those are people who can manage the information, the medical information recorded by a doctor or a certain person, in order to make sure that the patient information is secured and they are confidential, because they do not have to be shared with different people. Those people do not interact with the patient, but they are required to know some terminology used in medical, also the law of recording, and they own the bachelor degree in health information management. Also, the other non-clinical job is medical secretaries. Those are the people who wrote information from different medical offices. So those people have to manage those information and make sure that they are kept well. They are required to know different terminology used in medical. Also, they have to have the software skills, because nowadays hospitals are using the electronic way of recording information, so they have to know how they can use software like use of computer. Talking about allied healthcare professionals, it's like a healthcare segment which delivers service to different people. That's where there is a specificity of different career segment or branch where you can look for a certain service you need as a patient. Those professionals involve like dental hygiene. Those are people who are involved in treatment of people with teeth diseases. Those are the specificity of that branch, which where people can come for a teeth disease only, or which it's like a disorder, maybe disorder or a certain abnormality. Also, the other professional is radiography. Radiography goes of the use of radiation to treat a certain disease, especially they use X-rays. Those are the way they can use to take a picture of the people, the person which is inside, to know where there is a problem, so as they can cure it easily. Also, there is the rehabilitation counseling. Those are people who are involved in advising session, so they help people to with different disabilities, so by counseling them or give different social advices, so as to to know what the problem they are facing, and if it persists, they can look for other advanced assistance. Other professional is physical therapy. This goes with physical fitness, where it can be the person who broke like a leg or a hand, so that involved when the physical therapy used, it can be a specificity for the physical fitness only. Other thing is audiology. Audiology, it goes with the hearing problems. those the people who have different disease in, like in their, and in with the hearing, so they can join audiology so as to know the problem they are having in order to maintain it or to solve them. The other professional is health administration. Those are used to be called admin. Those are people who are the healthcare manager on health, or health service manager. Those they have to help the organization in the management. Let me talk about different types of healthcare career options. Those, as I mentioned before in the outline, they are licensed practical nurses. Those are those are nurses with the post post-secondary degree, like it's like they have finished secondary schools only. Those people, they provide basic nursing care. They work under direction of registered nurses and doctors, like assisting. Also, they work in many settings, like including they can work in home or hospital. Also, in some at some points they can work in, like in private homes, where people can choose to hire a post-secondary nurse in order to work as home their home nurse. Also, most of them they work full time. Talking about the registered nurses, those are people who, like they have a nursing degree in, like associate degree in nursing. So those people provide provide healthcare promotion. Also, they can work as a counselor or educating some patients about different difficulties they are facing. Those people, they can interpret patient information and make a decision depending to how they see the information of the patient. They can make a decision to a certain medicine which can be helpful for that person. Also, they can perform physical exams. In addition, those people, they can work in different areas, like in in camps. Also, they can work in a hospital, and even they can work for people who even do not have shelters, like those one in camps. That's all about registered nurses. Moving forward, let me talk about nurse practitioners. Those are like registered nurses, but with an advanced training in diagnosis or in treating illnesses. Those people are, they have a master's degree in nursing, which with addition with those advanced training in diagnosis and treating illnesses. Those people, they provide a primary and preventive healthcare services, where they interact with patients so as to know what they are really facing and how they can prevent those diseases. For instance, if it is epidemic disease, they have to make sure that they give patients different directions they can be using in order to overcome that disease. Also, they treat common minor diseases and injuries. For instance, for people who face a certain accident, those people can be in charge of those people in order to treat them. Also, they can work in clinics, hospital, or private offices, depending on where they got a job, but they really focus on working in hospitals and clinics. So thank you so much. Those are the references where I got the information from, especially for knowing what really healthcare career is, and some the non-clinical or clinical professional in healthcare, as well as knowing what is allied healthcare professional. So thank you so much.